Testing. All right, so we're going to get started on time. It's 2 o'clock. Thank you all for coming today. We're going to be talking about seasonal allergies. So hopefully everybody learned something. Can everybody hear me okay? Perfect. All right, just trying to get this to stay. Perfect. Okay, let's get going. All right, so allergy season is here. When I first started working on this presentation, it was coming, but I think we're here now after those last few snowstorms that we had to get. And so seasonal allergies are often referred to also as hay fever. So I just wanted to clarify that they are considered the same thing. So when we're talking about seasonal allergies, because there's a lot of different types of allergies out there, like food allergies and those types of things, I really just want to talk about what we're focusing on today, which is allergens that come with the seasons and come and go. So when we look at springtime, we're thinking of tree pollen as the number one allergen. When it comes to summer, we then get the grass pollen that comes out. Typically in the fall is the weed pollen. And then over the winter, we get a break from seasonal allergies, but then you have some more common allergens in the home when you get the heat going and you're more exposed to your indoor environment. Sometimes that's mold or dust mites. So specifically in the springtime, typically February to June, the peak being in April and May, we're going to see the tree allergies come. So I just listed the different trees that are producing pollen at that time. And then summertime, typically peak in May and June. We get the grass allergies as the grass is growing. Again, in the fall, that's when we're looking at weed allergies. So that tends to be August to November or until the first frost. So that just depends on the weather. And so a lot of times people will have another peak in their allergies in the late fall. And then when we talk about winter, again, we typically get a break from seasonal allergies, but then you're indoors more. You might be more exposed to pet dander, mold, dust mites. How cute is that picture, too? I was like, all right. So interestingly enough, there are more risk factors for certain people to develop seasonal allergies. Particularly, we see a lot of seasonal allergies run in families. So there is a genetic predisposition. Uh, the males tend to get seasonal allergies more than females. Being born during pollen season tends to help, attribute to the development of allergies, seasonal allergies. Being the firstborn of your family, you typically have more seasonal allergies, which I thought was really interesting. So I deep dove into that risk factor, and turns out that has to do with your mother's immune system that tends to get stronger with duplicate pregnancies, and she passes more immunity to subsequent children, that was very interesting. Early use of antibiotics, maternal smoking exposure, especially in that first year of life, and then exposure to indoor allergens or high levels of allergies earlier on in life. So those are some of the risk factors that we see with people who tend to have seasonal allergies. So if you've been to my presentations, I love to go over the anatomy because I think it helps really to understand what's going on. So if we were to cut off the front of his face or look through it with x-ray vision, you can see here that he has, really 3 chambers of sinuses there. So you've got your frontal sinuses, your ethmoid, which come in by your eyes, and then your maxillary sinuses over the cheeks. And those are all connected to the nasal passages. And if we cut his head in half and looked at him, you can see the different areas where the sinuses are and the nasal passages, the tongue, the mouth, how everything is connected within the whole upper airway, upper respiratory nasal passages. And then one other point I wanted to make a point of is to show the eustachian tube anatomy. So your eustachian tube is the tube that connects the back of your throat to your ear. And so it allows for different fluid levels behind the eardrum. And so it's important to remember that you have the eustachian tube, and a lot of times that attributes to when people have ear fullness or ear pain, when they get colds or have high allergies. So when it comes to the pathophysiology around allergies, it's a very complicated process. This is just the tip of the iceberg. And when we look at people who really suffer from refractory or severe allergies, there's a lot more cells of the immune system involved. But when we talk about the basics of what's going on when you get exposed to an allergen like pollen, is you get that exposure, and your B cells, which are part of your immune system, come to the area of that exposure. And then they're going to produce antibodies, IgE specifically antibodies. Those are the antibodies produced for allergens. And they attach to what we have called mast cells. And then those mast cells bind to that antigen to try to get rid of it and attack it. And that's when the histamine release occurs. And that's when you get mucus production, inflammation, swelling, all of that. So that's just the oversight of kind of the basics when it comes to allergies. And then I thought this was a cute little video. So our bodies were mistaking, pollen for something foreign and dangerous. And so then it comes to the site, and then that's when histamine is produced, and you sneeze, right? And that's how our body causes us to sneeze, is to try to get rid of that allergen in that moment. So when you are then exposed to that allergen, and we look at a similar picture of what I just showed you, you can see that allergen is going to come in through the nose or mouth, but typically the nose. And that's when you're going to get that reaction and mucus production and inflammation. And so you can see that's going to cause inflammation of the sinuses. Some of that mucus might go into the sinuses, into the eustachian tube, down the back of the throat, cause a cough, cause a sneeze, um, fill that congestion up. And so we see symptoms, which if you suffer from allergies, you probably are well aware. You can have a cough or feel like it's hard to breathe, feel tight in your chest, itching, sneezing, runny nose, headache, especially if you tend to have the sinuses fill up, itchy, watery eyes, and then some people will have rashes or hives. So these are just a few pictures. That picture in the top right here is what we call allergic conjunctivitis. So inflammation of the conjunctiva, which is the lining of the eye, caused by the allergy. And a lot of times we can tell the difference between that and bacterial or viral because you tend to get that red ring around the eyelids. With bacterial and viral, it presents a little bit differently. And then these are what we call allergic shiners, so having that dark area below the eye. So the other problem with seasonal allergies is that the more you're exposed to that allergen, the more persistent inflammatory response you have, the worse your response is. And so there's this hyper reactivity type reaction when you continue to get exposed to that allergen time after time. And so the more you're exposed, the worse your symptoms become, and the more levels of histamine that we see and other inflammatory immune system products. They actually, when they're studying this, they do like nasal washing. And so they'll rinse out someone's nose and look at what cells are there and track it over time. It's really cool. But so we see that it gets worse and worse with more and more exposure. And so that's why a lot of people year after year notice that their allergies are worsening over time. Sometimes it feels like what you've done before isn't working anymore, but it could be a little bit of both, right? So when we're diagnosing seasonal allergies, it can be a clinical diagnosis, so based on your symptoms and your history. But there are other ways to have a more confirmative diagnosis, although it's not perfect. We can draw blood and look for that IgE level that I mentioned for specific allergens. Again, that's not a perfect test. It tends to be very expensive, and it's actually not that sensitive. So you might have an allergy, and the test could be negative, but it actually is a false negative. The other test that we typically see done because it is less expensive and tends to be more accurate is skin testing. So I put a little picture up here of that. And so what they do is they put a drop of that allergen onto the skin, and then they open the skin, typically with a needle, and then they see the reaction, typically in 10 to 14 days. And so they can do it on the arm. Most often they do it on the back. So this is a good picture of a mapping of someone's skin test. So whoever is doing that test is keeping track of what all those little dots are. And then where you see those reactions, that's a positive test. So in some of these areas here, you can see there's no reaction at all. And then here, you're getting much more significant reactions. So that person's much more allergic to whatever that is, or is allergic to that, not to where there's no reaction. So prevention, we talked about the risk factors. So there's sometimes not much that you can do if you're born to have allergies, and you can't go back in time and say, "Mom, don't give me that antibiotic," or "Put out that cigarette," or whatever it may be. So what can we do now? What we can do now is when we know the pollen is high, keeping our windows and doors shut. So not letting that pollen into our in-home environment. If you do go outside, changing your clothes, washing them immediately to get that pollen off of them. There are ways to monitor the pollen, which I'll show you in a second. Showering to get the pollen off you, wearing certain masks to help with filtration of the air, and then using filters in the HVAC systems and those type of things. Which I did reach out to Devin and asked him because I said this might come up about our filters here, and he did say we have carbon filters, and so he's that are on the roof, and I think are working to filter out the air that does come into the building. So there is a website. There's a lot of websites actually. Even any sort of basic weather app or website typically will tell you the pollen level if you look for it. But I particularly like the American Academy of Allergy and Asthma and Immunology just because I think that there's a lot of good information there. But essentially, what you do is you put in where you live, your zip code, and they will tell you what the pollen levels are that day. So when it comes to seasonal allergies, they're uncomfortable based on the symptoms, but we also worry about them because with repeat allergy exposure, especially to the lungs, you can develop asthma. If you have a lot of that mucus staying in the sinuses, you can develop a secondary infection of the sinuses, also of the ears or the lungs. And then it's pretty rare, but because it is an allergy, it's not impossible that you could have an anaphylactic reaction to an allergen eventually, which would cause closing of your airway. Again, very rare for seasonal allergies. That's more if you ingest something like a drug or a food, but it's not impossible. Insect stings are common for anaphylaxis. Um, so let's go on to treatment. So I don't know if any of you watched this show Ghosts on it was on ABC. Anyways, this clip is from that because it's about all these ghosts that lived during this house over time, and she talks in one of the episodes about how cocaine is good for allergies. Which is funny to think about, right? So in 1886, there was medical journals out there that said to use cocaine for allergies, and then there was follow-up studies that said, "Oh no, you need higher doses each time to to be effective," right? And so how far we've come. We are not recommending that anymore, but I think it's just funny to talk about history when it comes to thinking about people trying to figure out how to treat their allergies in 1886. All right. So, in regards to allergies, we're working at preventing, right? So, you prevent the exposure as much as you can, but we all have to live our lives, right? And pollen will get to us eventually. So, what can we do? And so, to manage the reaction to the allergen, there's a few different things. The first thing that I would recommend is saline nasal products. So, saline nasal rinses, sprays. There's a lot of different ways now that they've figured out to get saline into your nasal passages and sinuses to rinse them out. So, I've got a bunch of them pictured here. I do have my own favorite that I use, but typically they're all pretty much made the same. And the main thing is that you know how to use it and can use it, right? It's going to work the best if you're able to deliver it. I think when things first came out, the neti pot, which you can see in the middle here, was kind of like the first one they were talking about. And that thing is very awkward, and to get it to go in and out can be very challenging. And some people have the trick, but now they have squeeze bottles. They have a navage, which is essentially something that's powered to rinse out your nasal passages. You plug it in. And so what this does, though, is it gets saline into the nasal passages, pushes it through the passages into the sinus, maybe even, clears out that eustachian tube, and essentially gets all that mucus out and gets all the allergen that could be in there, irritating your mucosal lining out. So, you can use that alone, and for some people that works. Some people during allergy season rinse their sinuses twice a day, and that's all they need to do. But for other people, they might need to do this and something else. The thing to consider when it comes to saline nasal products is you can buy the saline and it's delivered directly from the bottle, and so you know that it's sterile. But sometimes they provide packets, and so saline is sodium chloride water, and so essentially you would put the packet into the water and create your own saline. And so the main thing with that is you making sure you use clean distilled water. So you don't actually want to use tap water when you do that. Um, the reason for that is there is an amoeba that can live in water there have been cases, depending on where people have been located typically, where it gets into the sinus passages and causes inflammation of the brain, and people die from that. It is so rare, it's very unlikely to happen, but the gold standard is to recommend that you use distilled water or you boil your water for 10 minutes before using it in a saline solution. So, but this works really well. Neomed is a company that's pretty well known. They are not sponsoring me, or there's no benefits for me saying that, but they send me tons of stuff constantly. And so I do have some coupons and some handouts back there that if you want to take some, it just gives you kind of a list of what's out there. And I think there's like a rebate or something like that. But all right, so moving on from that. So after the saline nasal sprays, the next gold standard that we see the most effective regarding seasonal allergies are glucocorticoid nasal sprays, so steroid nasal sprays. That's going to be your Flonase, your Rhinocort, your Nasacort for the main name brands. So what the steroids do is they are anti-inflammatory, and so they work right on the mucosa to reduce inflammation, reduce mucus production, and help with symptoms. Most common side effects when it comes to steroid nasal sprays are going to be headache or nosebleeds. Um, they can thin the mucosal lining as they're trying to reduce that inflammation, and that's what can cause the bleeding there. If you do get a nosebleed from a steroid nasal spray, you should stop using steroid nasal sprays, or at least take a break, because that's telling your body's telling you that it's thinning your mucus too much. It should not be bleeding. The other thing to consider when you're using steroid nasal sprays is if you have any sort of intraocular disease such as glaucoma. In 1 to 3% of people, this can raise the pressure in your eyes, which, if depending on the type of glaucoma you have, could be dangerous to your eyesight. And so, if you do have glaucoma, it is important to talk to your doctor before using these. Important to talk to your doctor before using anything, especially because a lot of these are over the counter. But for the most part, they're pretty well tolerated and not that harmful. That's kind of the main caveat, is if you do have intraocular pressure issues. If you are doing saline rinses twice a day and using your Flonase, you want to do your saline rinse first and then use your Flonase. And then if that didn't work or do it enough, you could add on an antihistamine nasal spray. So as we talked about, the histamine is the main culprit of that inflammatory reaction. There is an antihistamine nasal spray. Works pretty well in addition to the Flonase. Again, doesn't work as well as Flonase or the steroid nasal sprays, but also can help for people who are not getting enough relief with that. For these, they tend to be poorly tolerated because of the taste. A lot of people don't like how they taste. And they can also cause headaches. Some people report a little bit of drowsiness because it is a histamine. But again, it depends on the person. So next I want to talk about nasal decongestants. Nasal decongestants you're going to see them on the shelf around all these other nasal sprays. Nasal decongestants work very well and very effectively and very quickly, which is wonderful. But when used in the nose, your nose starts to develop a reaction where essentially your mucous membranes start to, for lack of a better word, get a little addicted to the way the medication interacts with them. And so if you use it for too long of a period of time, as soon as you stop it, all your symptoms are going to come back and even worse. And so we recommend not using nasal decongestants for seasonal allergies. The only time it may be appropriate is if you feel like you're getting a secondary infection and you really need help getting that mucus out. And in those scenarios, you can use them up to 3 days safely. So you could use it for 3 days, see if it really did the trick to help you clean yourself out, but then you want to stop. So before we move on from nasal sprays, these are very tiny words, but I'm going to go over them. I just wanted to talk briefly about how to use a nasal spray the right way. So I think most of us think nasal spray and start to lean our head back, but it's actually no. You need to lean forward, and so you want to think about how do I get my nose and my sinuses as open as possible. And so there's a couple different techniques that you can use. Here is a picture of one that's recommended where you kind of pull your cheek over, essentially to open up that nasal passage and to get that medication in. Another way that I was taught in school is to tell people to use kind of opposite hand, opposite nostril. That way, if you're holding the nasal spray, it's kind of directed up this way into the center. If you're directing it out, it's just going to hit the side of your nose and not actually get up and into the sinuses and into the nose the way you want it to. Another thing that's important is not to sniff very extremely or hard or as you're dispensing the medication. It's actually better to dispense and then sniff slowly. If you want to plug the opposite nostril, it kind of helps just to really sniff on that one side. It's never good to blow your nose or sniff vigorously. When you do that, you actually push things further back. So a gentle, steady sniff in or sniff out if you're blowing your nose is what's going to be the best for you. All right. Oops. I don't know what I touched. Okay. All right. So now I'm going to go on to oral medications. So I'm going to talk about oral antihistamines. So as we talked about with the nasal antihistamines, when you have allergen exposed, that mast cell releases all of that histamine, and that's really the main culprit of the reaction. Here in this picture to the right, though, I put that there because I want you to realize there are 4 histamine receptors in the body, H1 through H4, and they all are used for different things. So histamine is not only an allergy reaction, it helps us with the mucus in our gastric lining, our gastric secretions. So famotidine is actually a histamine 2 receptor that helps with heartburn. So, not all histamines are the same. And then when it comes to the antihistamines, there's a few different ways that they work. And so that's important to keep in mind too. So we have first generation and second generation antihistamines. So I'm going to start with the second generation because that is what I'm recommending for use. So when it comes to second generation oral antihistamines, we're talking about our Allegra, Claritin, Xyzal, Zyrtec, so loratadine, cetirizine for generic names. And so the main difference between these and the first generation is they're less likely to cause drowsy or dizziness. And so they're a little bit more specific to those histamine receptors that avoiding the ones in the brain that are going to cause that drowsiness and dizziness. And for the most part, these are well tolerated. Loratadine, which is the generic name of Claritin, tends to have the least amount of interactions with other medications, and so it tends to be more commonly used. But they all work very similarly, and some people find that one works better than the other, just what their body responds to. If you go to the pharmacy, you're going to see that they add D to probably all of these, which means that they added a decongestant in. Again, like the nasal decongestants, that's going to help open up the airway, but that comes with its own side effects. So the way decongestants work systemically, they can raise the heart rate and blood pressure, and so we don't recommend taking those regularly. So it's important to be really careful that you're taking just the antihistamine and not a decongestant with that unless you've been advised to do so by your doctor. Most common side effects for antihistamines are headache, but they're pretty well tolerated, they're pretty safe to take, and they work well for most people. So when we're talking about the first generation of antihistamines, these are often in everybody's medicine cabinet, which isn't necessarily a bad thing. We have Benadryl and Atarax, the 2 kind of most commonly known. Again, the first generation antihistamines tend to be more sedating because of how they work on the 1 receptors in the brain. And because of that, they can cause issues with balance, lightheadedness, dizziness. Um, they tend to be more anticholinergic, which means they kind of dry secretions more and tend to affect older adults in regards to memory and confusion. And so they really aren't recommended for anyone over the age of 65. In acute needs, when someone's having a potentially anaphylactic reaction to an allergen, we tend to use Benadryl because it works very quickly. But otherwise, this shouldn't be taken routinely for seasonal allergies. So, got another one. Okay. And then now I'm going to touch on the allergic conjunctivitis, which I talked about and showed you that picture of. So, similar products when it comes to eye drops for allergens as we do for the nasal passages and orally. So, you have antihistamine eye drops, vasoconstrictor eye drops, and mast cell stabilizers. Um, Most of these are available over the counter, and they all work pretty similarly, and so it just depends on the person and what they respond to, but they work pretty well for the itchy, watery eye reaction if that tends to be your main symptom. And then last but not least, there is the option for allergen immunotherapy. Typically, this is done earlier in life to hope that it lasts longer. But if someone has really severe allergies that are refractory to all treatments, um, they consider doing allergen immunotherapy, which is allergy shots for kind of the layman term. And what that is so they inject, it's similar to, I like to compare it to a vaccine, which is kind of how they put it here. But essentially, they're injecting small amounts of the allergen and allowing your body to react slowly over time and monitoring that closely. Um, and it does work pretty well, 5 to 10 years, depending on the person. Um, but if you have really severe allergies, it is an option. They tend to do allergy shots more so for people with bee allergies or more allergies that tend to have that anaphylactic reaction. Right. So that is my allergy talk. Does anyone have any questions or thoughts or concerns? There are some drugs that are being studied that work further down the allergy cascade. Um, they're kind of complicated. They're not available over the counter. Typically, you need to see an allergist to get them, and insurance coverage can be quite complicated. So I didn't go into that because I didn't feel like it was really necessary. But of course, if anyone has interest in hearing more about allergies, I could do a second talk on all of those. So.
Um, I unfortunately have once every season I have something to react to.
Mhm.
Lucky person. Um, and so I've been told to take 1 tablet a day. I was also told that loratadine, after a while, loses potency. Taking it often, told to use Parazine. Does that make sense to you, or?
So, I don't know that there's any clear studies of ineffectiveness over time. I think part of that is exposure and your body having more of a reaction. And I think I kind of talked about this a little bit, but sometimes switching to different ones can be helpful because they are all a little bit different, and so it might kind of just give your body like okay, this might work a little bit better than the last one, depending on your genetics, your DNA, all of that goes into how your bodies react to medication. Um, but yeah, I think that people tend to experience their allergy medication not being as effective. And I'm not sure if it's losing its efficacy or if they're being exposed more. It's hard to know, but I think rotating to a different medication is reasonable to try. One thing that's important to remember is you want to take all of these medications, including the nasal sprays, for at least 2 weeks to see how they work. They don't tend to work right away. If they work for you right away, that's great. But you really want to give it a couple weeks to see if it's effective or not.
Are most people who get allergies, is it a lifelong problem, or can you not have allergies at all and suddenly start at an older age?
Yeah, so I mean, unfortunately, there are people that do have the lifelong problem, and that tends to be that genetic predisposition. People that we call them atopic, right? Because they tend to have eczema and asthma, and their bodies, their immune system just recognizes most things as foreign and overreacts to it, and it builds with time. But you can develop an allergy at any time in your life. And sometimes all it takes is just your body recognizing something a little bit differently and then starting that immune cascade. And some people, claim to grow out of their allergies. I think that changes a little bit more when it comes to food allergies. But when it comes to seasonal allergies, we do tend to see that build. Also, with climate change now, that's changing a lot of things. Things being more wet, things being more hot, like the environment makes a big difference too, air quality. So that's something that can really affect how people's allergies develop with time.
Is there any daily cycle of allergies? In other words, reaction is sneezing.
Yeah, so I mean, we kind of see the peak pollen midday when it's gotten warm and early morning that time. But when it's cooler out, when the sun is down, things tend to be more settled, and so that's the time of day to go outside and spend your time outside if pollen tends to be your issue. But yeah, there's definitely peak times during the day. Part of those trackers are going to tell you that too. Actually, if you look on your weather apps, they'll tell you when the peak pollen time will be.
Normally, it would be later in the day.
I would say midday typically.
Midday.
Yeah. Get the wind whenever, especially with wind too, like a windy day will change everything. That things start to move around. Any other questions? One thing I didn't touch upon is the use of prednisone orally. It's not recommended for seasonal allergies. It's really recommended acutely for a short-term period for a reaction. But if someone is having an acute reaction, that is something that is used. And again, that's prednisone, so it's a glucocorticoid oral medication. So it's what we're putting in our nose with the nasal sprays, but by mouth. And so it's not recommended that people go on prednisone or a glucocorticoid orally for seasonal allergies because it's not good to take those long term. All right. Very good. Thank you guys for coming. I wish you a very mild allergy season.